Senator Scott.
Thank you, Mr. Chairman, and to the panel. Thank you all for being here virtually. Without any question, we find ourselves in a situation that we wish we were not. But I'm very thankful for folks like Dr. Birx, Dr. Fauci, and many others for your dedication 24/7. Without any question, our nation is safer because of your hard work. I'm going to direct my questions towards Dr. Fauci, really one specific question, Dr. Fauci, and I'm thinking about the reopening of America and specifically the reopening of South Carolina. And I'm taking into consideration the fact that in South Carolina, I think overall our cases are moving in the right direction. We have a little less than 8,000 cases, unfortunately 350 deaths. Our hospital capacity is actually better now than it was when the pandemic started. Our ability to isolate hotspots and mitigate the spread of the virus is, I think, where it needs to be. With that in mind, I flew into Washington from South Carolina yesterday. We have plans to test additionally 220,000 more residents by the end of this month, focusing on at-risk populations. By the end of this month, we will have tested 100% of nursing home residents and the staff that takes care of them. And after increasing our contact tracing workforce 20-fold in the matter of weeks, our state's health department announced yesterday that we're going to increase it by an additional 1,400 contact tracers. We have built and we continue to build the tools necessary to better detect and isolate cases, to map their exposure, and to prevent substantial spikes moving forward. Most importantly, our healthcare system, thanks in part to flexibilities from this administration, has the beds and the equipment necessary to address the most serious cases when they arise. Now, with these tools in hand, we have begun to reopen. To be clear, we continue to scale up testing and to take measure to protect the most vulnerable, and the data points are increasingly clear. For older Americans and for those with chronic conditions like diabetes and high blood pressure, this virus remains a threat, a dangerous threat. A recent report suggested that in New York, roughly 90% of the fatalities had underlying issues. 2/3 of fatalities were 70 years or older, 95% over the age of 50. In South Carolina, the median age of patients who've died from the virus, 76.5. Nearly 2/3 of fatalities have been patients older than 71, and nearly 90% were over the age of 60, and roughly 98% in South Carolina are over the age of 50. Contrast that with those aged 20 and younger, where we've seen no deaths. Fewer than 1% of deaths in my state have been under the age of 40. Every single death is a tragedy, every single one. And we mourn with our family members who've lost their loved ones. We are taking every measure to protect our older South Carolinians as well as those with underlying conditions. But when we set out to flatten the curve by taking aggressive, unprecedented measures like staying at home orders and mass small business closures, we didn't set out with the goal of preventing 100% fatalities. That would be unrealistic. It is impossible. And we didn't set out to keep quarantines in place until we found a safe and effective vaccine. That would take too long. Dr. Redfield, your agency put out a helpful graphic showing two curves. One, which spiked quickly and peaked high, reflected daily cases without protective measures. The other, flatter curve, showed cases with those measures in place. And the whole point, which the graphic illustrated, was to make sure that we did not exceed hospital capacity. So, while I respect the need for caution, we are too often presented with a false dichotomy, either saving our economy or saving lives. We've seen the goalpost around flattening the curve move, and I think that's unfortunate, because at the same time we're doing that, businesses have collapsed. Mental and physical health have declined. Depths of despair escalate, educational outcomes nosedive as we wait in our living rooms praying for some good news around therapies and around vaccines. We set out to flatten the curve, and I think we've done a pretty good job of that. We need to do better, and we will do better. My question, Dr. Fauci, is as we start the process of moving towards reopening South Carolina, what else would you suggest that we could do to protect our most vulnerable populations?
Thank you, Senator Scott. You gave a really very eloquent description of what I think is would be a model way, the way you've approached this. I mean, you have put things in place that I think would optimize your capability of reopening. And as I was thinking as you were speaking, I'd almost want to clone that and make sure other people hear about that and see what you've been doing. The issue of your direct question to me about the vulnerable populations is that, as we have said in our guidelines, and it looks like you are ready to progress carefully because you put into place a very good system, that the vulnerables, the elderly and those with underlying conditions, should be those who at the very last lifting of mitigations should be those who are left in a situation where they might be in danger of getting infected. In other words, protect them right up until the very end of the relaxation of your mitigation. Because as you said very correctly, those are the individuals that are the most vulnerable to the morbidity and the mortality. So those are individuals, particularly I might say, sir, those in the minority group, the African American and Hispanics, who for a variety of situations that are the social determinants of health have a greater likelihood of not only getting infected, but of also having the underlying conditions that would make their risk for a high degree of morbidity and mortality higher. So it looks like you're doing things very, very well, and I would encourage you to continue and to follow the guidelines as you get closer to normalizing your state. Thank you.
Thank you, Dr. Fauci, and I'll just simply close with this since I'm out of time. Thank you for the many conversations that you and I have had about those vulnerable populations, to include minorities as well as our senior citizens. I will say that without any question, when you look at nursing homes, it's typically African Americans and Hispanics are the certified nursing assistants who are providing care for the elderly population. So your focus on those two very vulnerable groups is much appreciated, and thank you for your expertise.